Hey guys, my name is Sydney. As you know, I work in the mother-baby unit, and of course we are not on the front line. The front lines are the people working directly with COVID patients every single day. That's your ED, that's your ICU usually. A couple of ways that just the hospital system has changed is that we are now screening patients at the front of the hospital. They have to answer questions in order to be let in. I know I sound like I'm out of breath. I'm running around rampantly. So that's being done. We are not allowing any visitors for any patients unless you are a pregnant patient who has delivered a baby. So our unit is the only unit in the hospital right now that is allowing visitors. And then actually in our NICU, we're only allowing moms, not even dads. So everything is quite restricted. Obviously, we all are running low on supplies, PPE equipment, mask. We are now allowed to get masks. They're passing it out to us once a week. We're allowed to change out our mask. They're just surgical masks. They're giving N95 for those in direct contact with COVID patients. Other than that, there's not really much I can speak on. So I have had a couple of friends and I have gathered some help to kind of just explain how all over the nation our hospitals are being changed drastically, and just how that has affected certain units and certain people. So enjoy.
Hi everyone, my name is Monica. I'm from Texas, Dallas specifically. I work in the neuro ICU during this whole COVID-19 that's going on. I personally haven't been taking care of anyone that has coronavirus. They have been transferred down over to the general ICU. I have gone down there and tested in the general ICU where they have the corona patients, and it looks like a war zone. It's crazy. A lot of patients on rotoprone, very, very sick individuals. It's kind of crazy that I started out my first year as a nurse during a pandemic, so this is great. Adds to resume. But some things that I would like to see my community doing is please stop using gloves. Just please stop using gloves. You are cross-contaminating like everything. Wash your hands, or like I said, sanitize at the location that you're at, and just clean your things when you get home and sanitize everything that you brought with you to the store. I think that's a better idea, but whatever makes people feel safer during this pandemic, which is pretty crazy because I've seen some really ridiculous things, but I think that's something that I'd want to see in my community changing.
Hi, my name is Taniqua Chanel. I'm a registered nurse in Los Angeles. I just wanted to mention a few things that I've dealt with during this COVID-19 pandemic. So one of the things is that before everything started shutting down, before it was being reported that this virus is in the air and it's so highly contagious, the nurses started to wear masks. Once those cases started popping up in the US, they immediately was like, I'm gonna wear a mask, I'm gonna protect myself and my family. They had some underlying health elements, so it made sense. However, our managers told them not to wear the masks. She asked them if they were sick, and she said, unless you're sick, you don't need to wear a mask, and give the impression to our patients that you're sick. And she made them take it off. Another thing was we had lack of supplies, like a lot of other places. We just didn't have enough. So some people, knowing that they would come to work one day and not have enough, they started saving their masks and wear the same mask that they had on all day for the 12-hour shift, wear that mask 2, even 3 times in a row, 3 days in a row. And that just is just crazy that fast, once things started getting bad, we immediately didn't have enough supplies and they were locking them away in the office. We didn't have any clear-cut guidelines as far as our unit with mother baby. There were no strict, this is what you're gonna do, this is what you're not gonna do. And then when they did come out, it was, oh, they're gonna separate mom and baby and have them in separate rooms, which made no sense to me at all, how a newborn baby, a few hours old, is gonna be in a room by itself. But that's what it was. So people just were still in panic and fear because no one knows what the heck they're doing. And it seems like they still don't.
Hi everyone, my name's Kylie. I'm from St. Louis, Missouri, currently working as an RN on a medical surgical floor / oncology during this period of the COVID-19. My hospital basically designated a certain floor to where all the COVID patients can go. As far as how it's affected our hospital or even my floor, I would say honestly, we can't even take the amount of patients that we normally do. At my hospital, we have double beds, and right now, all of our double beds are cut into just single rooms. So it kind of limits the amount of patients that we can get, and then also staffing. Staffing has changed drastically, kind of making it, I feel like, well, in my opinion, just a little harder. Kind of makes work a little more exhausting. But I mean, I guess that just comes with the job. That's nursing. And I know it's only temporary. So, I mean, just as long as, we're all trying our best to pull together and do what we can to get through this. Me personally, I'm trying to keep away from a lot of family and friends just because I know being in the hospital, I can pose a bigger risk of getting it and spreading it to others. So I just try to stay to myself for now until this is all over.
Hello everyone, my name is Asia Wright. I am a nurse here in Atlanta, Georgia on a med-surg unit. I see patients with pneumonia, UTIs, renal failure, heart failure, liver failure, you name it. I've seen it on my unit here. Since COVID, I will say the climate on my unit has definitely changed. We started to see people that were getting tested for COVID. And before being a nurse, I'm human, and so that definitely enticed some fear in me a little bit. But you pray and you make it through it, and everything is going to be okay. But I will say, when they test negative, they stay on our unit. When they test positive, they leave our unit and go to a designated COVID floor, which is nice. But I will say we have had some false negatives. And so, like I said, once again, just kind of that enticing of fear and like the unknown, like anybody else, it's kind of scary. I had one patient who tested negative and actually ended up passing away, and the autopsy revealed that it was a COVID death. But at my hospital, I never felt like I could not get access to a mask, that I couldn't have access to gloves or any other PPEs that I might need, like a face shield or eye shields or gowns or what have you. I will say, I have been focusing on the positives too. We've had several hundred being discharged that were positive, successfully home with their families. And so that's also, exciting and very rewarding in my career as well. So I know that you may not be sick or you might be young and well, but think about that family member that you live with or just your own health, because I'm type 1 diabetic myself. So I'm immunocompromised already, and I'm already seeing, some of these patients come in, and I'm like, oh boy, here we go. And so it's exciting, it is rewarding, but at the same time, like anybody else, it's the unknown. And so we're just learning every single day.
But my name is Serena. I live in Atlanta, Georgia, and I work in the neonatal ICU, or NICU for short. We have eliminated all parent visits. We did compensate by doing FaceTime videos with the parents and sending pictures every day throughout the day. So to give them that same feeling of being able to visit, it's just virtually. We have to wear masks and we get screened before we can even go to work in the mornings. And I just want everybody to continue to stay home. Although the city is opening, still stay home. I work with some of the most innocent and fragile individuals that don't have immune systems.
Just to speak on behalf of those who work in the ICU and ED, I have seen ICU nurses, ED nurses who have indentations on their face, little ulcers on their face from wearing their mask for several hours of the day, just from being inside of a patient's room for 3-4 hours at a time, because we're low on gown supplies. I know some people have floated from different units to the ICU just to help pass supplies to the nurses who actually work in the ICU, because they have to stay in the patient's room to prevent having to take off their gown and get a new one, or prevent taking off their gown because they don't have any new ones to use. It's a very scary thing, not knowing who has what, from patients to coworkers to administrative staff, just everyone you come in contact with. But that's why you need to stay protected. I went outside today to Target. There are so many people without masks who have their babies out without masks. You guys, the state is open, but let's be smart about how we're moving. People are still dying every day from COVID. Move smart, please. If you cannot protect yourselves, please stay home.
Please stay home.
And stay home, okay?
Everyone stay safe.
We're all going to get through this together.